Hi everyone, hope you are all safe during this COVID pandemic. I am Dr. Kokila, Consultant Obstetrician and Gynaecologist from Velache. Today I am going to share an important topic which is pre-pregnancy counseling or preconceptional counseling. So what do you mean by pre-pregnancy period? It's the period before getting the pregnancy. So it usually lasts 3 months before getting the conception. So I'm going to present this topic into two parts, where the first part I'll concentrate on the ovulation, that is fertile period during a menstrual cycle. And the second part I'll share an important tips to follow in your day-to-day practice to lead a healthy pregnancy. So the first today is the fertile period, that is knowing about your ovulation. In a female, the reproductive organs are the uterus, the tubes, two tubes, right side fallopian tube and left fallopian tube, and the two ovaries, right ovary and the left ovary. In an ovary, there will be million number of primary follicles when the girl baby is born. Among these follicles, one follicle will develop into a mature follicle and release an ovum. This is called as ovulation. So in a normal menstrual cycle, the duration lasts for about 28 days to 35 days cycle. We will divide this menstrual cycle into two parts. First part is the lasting from day 1 to day 14 and the second part lasting from day 14 to day 28. So the ovulation happens on 14th day. Many they'll ask, doctor, whether this ovulation will be on 14th day exactly? No, it can vary from 48 hours before or 48 hours after. So it can vary from 12th day to 16th day of her periods. When I say the day 12, it means starting from first day of her period. Here also many they'll take a mistake. That is, when we say day 1 of period, they'll calculate from the day when it gets stopped. But it is not like that. It is the day when she had the period will be calculated as day 1. From that day, the process will start for the ovulation. So when we see the follicle size around 10 mm on day 5, every day it grows up to 1 to 2 mm, and when the day around 12th day to 14th day, it will mature around 18 to 20 mm. I mean the follicle will mature around 18 to 20 mm on day 14 or 12th day to 16th day to release an egg. So when I say that the follicle get ruptured and it releases egg, many they'll get afraid. They'll ask that, madam, you are saying that the follicle got ruptured. Wouldn't I need to worry about it? Definitely no. You imagine an egg. The egg has a shell and a white part and inside an yellow part. When the shell ruptures, it will release an yellow part that comes as a chick. So that is the living part. Same way in a follicle, it will be the ovum will be surrounded by a fluid. When the follicle ruptures, it will release the follicular fluid. With that, the egg or the ovum will be there. So this ovum will get attracted through the tubes and it will stays in the tubes. So when the couple, they are planning for pregnancy, they will have contact around 12th day to 16th day. The sperms from the vagina, it will migrate through the cervix, uterus, reaches the tubes and gets fertilized in the fallopian tube. From the fallopian tube, around 21st day, it will come and implant inside the uterus. So this will call it as an ovulation. So this rule is applicable for those who are having an regular periods. I mean the regular period which lasts from 28 days to 35 days. But for the irregular period, this rule will not be applicable. We were not very sure about when she ovulates. So the ovulation or the follicular monitoring, follicular tracking will be done only with the ultrasonogram. For those with the regular period, they did not come to the gynecologist to check that whether they are regularly ovulating. They themselves will be able to know. That is, first thing is they feel that the body temperature has been little high. That is, around the time of ovulation, compared to the normal temperature, the 1 degree Fahrenheit would be on the higher side. Second thing is the vaginal discharge. They themselves feel that the discharge will become more in amount, stretchable, easily up to around 8 to 10 centimeter. And another thing is the right side or left side pain. There will be mild abdominal pain or some discomfort around the timing of ovulation. So these are the presumptive evidence of ovulation to say that she is regularly ovulating. So the couples who are planning for a pregnancy, they should have a contact around the timing of ovulation to get a successful pregnancy. So in the next video, I'll share you 10 important tips to follow in your day-to-day life to lead a healthy pregnancy. So wish you all a very happy planned parenthood. If you have any doubts regarding this presentation, You can comment in the comment box or you can visit to my clinic, Phoenix Specialty Clinic, Velache. Thank you.